Hello, everyone. I'm really pleased to welcome you today for this post-show webinar after the New York Suppliers Day. It was held just last week. So we will have 4 conferences today, and I will present at the end of this webinar the testing trends of the North America territories. So we will start NYSCC Suppliers, Byome Lab and CIDP and Cortex. We had the pleasure to co-exhibit at New York Suppliers Day, and this webinar is the opportunity for you to know more about them. So we will start first with Tim Hauser presenting the expertise of the instrumentation developed by Cortex. Then we will have the presentation of Dr. Renato Moura from CIDP Brazil. And after the presentation of Per Svedenhag for the NYSCC device by Scibase. And finally, we will have a video from Margaux Jeanmougin because she was at Vivatech, so she was not able to be there today with us. But and after I will present, it will be 3:40, around 3:40, and I will present you the trends of the testing expertise in US and in North America. So let's start. Each presentation lasts 10 minutes. There is a Q&A options. You can write your question. We can ask each speaker after their presentation. So it's really easy, or there will be also a Q&A session after the whole presentation. So it's really what you prefer, and don't hesitate to ask your question. Thank you very much. I let the scene to Tim now, and thank you for sharing your screen. I will stop mine. No, I'm not sharing, so let's go.
I will start sharing now. Hello, everyone. Whoa,
maybe Per and Renato, you can stop your camera.
One minute while my computer is a little laggy.
Yeah.
Which is a CRO outside of Philadelphia in the US. And we are affiliated with cyber implementation. It appears as though I was kicked off. Give me 1 second. All right, just pick back up. I hope everyone can still hear me. If you're not familiar with Cortex, they make a suite of instrumentation similar to Courage Kazaka that can be used to do a lot of non-invasive testing. Here are some images of their full suite and their aesthetic suite. And on the right, I also have their colorimeter, DSM-4 colorimeter standalone, which is what I'm going to be talking about today. Very exciting instrument that I've been using a lot since it's been released. This is an example of the graphic user interface for collecting data from this. And one of the things that I like about this instrument is it gives you a very clear output of what the measurement was. And you can see on here, we actually took measurements from a spot on people's cheeks where they had even skin tone and another area where they had hyperpigmentation. And you can see the clusters of data from those. So you've got a pretty good idea right off when you're taking measurements that you're getting accurate data. So once we got this equipment in our hands, I wanted to interrogate it and find out how much we could get out of it and what its value was over current colorimeters. And thinking about how we use colorimetry and skin pigmentation in general. One of the things that we have been working on at Dermaco is moving away from using Fitzpatrick skin type uh, as a uh, as a tool for qualifying subjects for studies or determining different factors on studies. We find it to be kind of a blunt tool. But it's widely used because it's important to classify people based on their skin's response to UV radiation and other factors. But it has limitations, the way that we do Fitzpatrick skin type classing. So with validating this instrument, I wanted to focus on the ITA value that it output and see how we could use that to improve the studies that we do and compare that to data that we would get from the Minolta chromometer. So we actually were able to do this by incorporating into several different study protocols and consents that we would collect data for this separate purpose from subjects that were coming through. So we collected data on 4 different studies from 98 healthy adult subjects. When we collected data from their upper inner arms as an area of constitutive pigmentation and from their cheek, mid-cheek, as an area of facultative pigmentation with both the Minolta chromometer and the DSM-4 colorimeter, and we did triplicate readings under controlled conditions. And so the first set of data I wanted to share with you showing the correlation between the ITA values from both devices are very well aligned. On the cheek, we see an R-squared value of 0.94, and on the upper inner arm, we see an R-squared value of 0.97. So we were really happy with that. Whoa, keep losing this, sorry. With that correlation, especially compared to older DSM devices that did not have the same illumination that would produce LAB values comparable to the chromometers. So we also, as part of this study, had people self-assess their own Fitzpatrick skin type based on the classic questionnaire. And then we also had an expert grader rate their Fitzpatrick skin type based on their methodology, including asking them those questions, the way that it would be done in most clinical studies. And what we found is very poor correlation between what an expert grader would perceive as someone's Fitzpatrick type and what they perceive based on the questions that you're supposed to ask. Some of them being very far off. As you can see on this chart, we even had a person that we classified as a 6 who classified themselves as a 2. And we also see the correlation between ITA values and Fitzpatrick classes, no matter where the measurement was taken, isn't very great. And this, we can see broad groups here, but we see a lot of overlap between groups. So from our perspective, this highlights the lack of precision of Fitzpatrick skin typing. But what we did see in the trends with this data is that the ITA clearly decreases with increasing Fitzpatrick skin type, which is what we would expect. But they're not interchangeable, and there is wide variation and overlap. And specifically when you get up to types 5 and 6, which is interesting because if you read a little bit about the development of Fitzpatrick skin type, classes 5 and 6 are actually added later and were considered a little bit differently from the original 4. And then we also took a dive into the redness parameters and the delta A star values from the DSM-4, and we're able to show that the delta A star increases with lighter ITAs, indicating that darker ITAs also may have a photoprotective melanin effect, reducing erythema. So our conclusions from this work were that the ITA value allows for an objective classification based on skin tone, which helps overcome some of the Fitzpatrick skin type issues that we have, especially with reliability and consistency of self-reporting and greater variability. And the DSM-4 specifically is a very easy and convenient tool for collecting ITA values, along with other objective color data. So much so that at this point we keep one at our front desk, and it's part of our standard intake for new subjects enrolling here. We collect ITA data from their upper inner arm so that we can include that along with their Fitzpatrick type on anything in our database for recruiting purposes. Well, the limitations of the studies we've done so far on this, though, are ethnic diversity due to our local panelist population. So most of the subjects in there would be classified in like the types like 2 to 4 range. Very few 1s and 6s. So we do need more people of darker and lighter skin tones to get more information about that. And then we would just like to see larger numbers as we continue to collect data and explore the rest of the indices in the DSM-4. I would like to thank Dr. Gary Grove, who he and I did this work together, Mary Grove and Brittany Bratton, who did all the measurements for this, and Dr. Gary Grove and Marissa Stoller, who did the data analysis and statistics. And I think that is exactly 10 minutes. So if anyone has any questions.
Thank you very much, Tim. It's really precisely 10 minutes, 10 minutes from the US. At this point, there is no specific questions. So please just choose the question and asking chat to ask your question, and then I can ask a team. We can also you can also ask your question at the end of the webinar to team if you have some news one. Maybe now we will go through the CIDP presentation. Thank you very much, Tim. You stay with us now. It's Dr. Renato Moura from Brazil. Today, for this webinar, we are really in the different continents. And so, Renato, could you share your presentation?
Absolutely. Can you see it?
Yes, this is perfect.
It's nice that we all together joined from all continents all over the world. Thanks for having us here, and thanks for watching this presentation. It's a pleasure to be with you. I am Renato Moura. I am a dermatologist here in Rio de Janeiro, Brazil, and a clinical investigator for in vivo clinical studies, cosmetic efficacy, safety, and tolerance evaluations. And I am part of CIDP, a CRO for preclinical trials and clinical studies. We are in 4 continents, and that's where diversity comes in, and that's where we are able to work together to build a science that respects and evaluates the diversity in the accurate way. All right, so let me just introduce a little bit of what Brazil is and why I'm talking about it. We are actually the 3rd biggest cosmetic consumer in the world, in a population of over 200,000 people, and we are especially a very diverse, but not only diverse, but actually an admixed population. Throughout the last 5 centuries, we have gotten immigrations from all over the world, and that's what makes our diversity, and that's what makes this admixture both a challenge and an oasis for clinical research. So, as a dermatologist, we're always looking at the images, and we're always looking for ways to better enhance our little tool, the eye that we have, and how can we expand what we see in our clinical trials to better understand the skin and its different pathologies, such as acne, photoaging, and atopic dermatitis, or scalp for hair analysis, for instance. And talking about that diversity, we really need to take advantage of that and actually look at how the skin is going to present the same pathologies, such as the acne-related spots, in lighter and in darker tone individuals. This is important to realize because each individual will present a different kind of spot, and we need to analyze and we need to track those with precise referential atlases. CIDP is working on that also and working on seeing through images, acne, seeing all pathologies. And through that diversity, we would like to understand what makes each skin so unique and what are the features that every phototype and every ethnic diversity can present to us. So when talking about hyperpigmentation, we see melasma, a very common skin disorder, and we have these intensities that had to be analyzed by the doctor in the clinical setting. And it's very important that the doctor has a referential atlas to look at and be able to complete the evaluation that we usually do with, for instance, the MASI, which is the melasma area severity evaluation. In this case, we have a subject on phototype, skin phototype Fitzpatrick 4, displaying the different intensities of color and contrast on the skin. So, just for comparison, if you look at the severe intensity in different phototypes, you see how different these features of contrast and color intensity are going to present on different skin phototypes. And that's why it's so important that we rely not only on our eyes, but also on the technologies that are available to us nowadays. So when we're talking about evaluations of safety, especially in skin of color, it may pose a challenge to actually see these reactions. So the erythema, the desquamation may not be visible under regular lighting or under direct eye examination. That's why we need these images. So in this case, the subject was presenting a mild reaction, but then we used the polarized and UV lightning to show how the upper layers of the stratum corneum are actually detaching from the skin and reflecting like mirrors the UV light. So this is why we need these tools to work on the diverse population. We cannot rely on just the image or the direct examination, and sometimes work with the instruments like my friend was explaining before me. We also need to apply that for the evaluation of wrinkles because every population will show different features and in different ages concerning wrinkles and fine lines. And especially now that we have even more tools that will analyze through AI the wrinkles and the changes in the photographies throughout the time points, we need to have referential atlases and we need to have these materials in order to work and to be able to accurately evaluate in our population that is so diverse. And this is a representation of the wrinkles on lower and higher phototypes that we are working on here at CIDP Brazil. We're also working on using our tools to analyze the scalp for hair treatments and scalp treatments. And here's an example of how the scalp can show differently and the pigment network can present differently in different skin tone individuals in the microscopic image. So here you can also use these tools to actually reposition the images with very high accuracy. So in a separate time point of 48 hours difference, we are able to see the growth of the hair and able to track precisely the same location on the scalp. This is a breakthrough in technology, and this is what we are applying today in our studies. Also, when we look at the two different time points and you're able to reposition the image, you're able to see actually the hair on blue that's growing, as you would expect, and the hair that's on its late telogen phase. And that hair highlighted in red, it's not growing. And throughout the AI analysis and the software, we're able to quantify these changes and to give counting and measurements for the hair follicles in a certain area, being able to track that area very precisely throughout the time points. This was my short presentation just to show how we are applying these technologies and expanding the human vision towards more accurate evaluations for efficacy and safety studies. Thank you for this time.
Thank you very much, Dr. Renato Moura, for this very nice presentation. Thank you for the time respect. At this time, we don't have any question, so we will go further, and I will introduce Mr. Per Svedenhag from Sweden, who will present the Scibase and Nevisant instrumentation to analyze and quantify the effect on the skin. Thank you very much.
Thank you, and I'll try to share my screen. Is this? Can you see my screen now?
Yes, perfect.
Okay, very good. So welcome to Scibase. We're a company from Sweden, originating from the Karolinska research at the Karolinska Institute in Sweden. Let's see. Yeah, so what we are providing is a method for point-of-care skin analysis with our unique method of electrical impedance spectroscopy. It's based on the 35 years of research. It started at the Karolinska Institute, and it's documented in more than 85 publications and more than 5,000 patients. And it's actually in use today in clinical practice in almost 500 practices and with more than 200,000 tests performed to date. So it's a device that is actually today used in clinical practice. Not so much, of course, perhaps in your area, but in melanoma detection and in non-melanoma skin cancer detection. But we're also working in skin barrier function research within skin barrier function. There are more than 35 studies ongoing in different areas: dry skin characterization, pharmaceutic and cosmetic and skin type characterization, and so forth. There are a lot of different research, all of which can be found on our webpage in skin irritation, skin hydration, stratum corneum characterization, UVB irradiation, skin effects on seasons, and so forth. We have a lot of things also regarding atopic skin severity and healing. So there are a lot of different utilizations of our method. But what's it all about? Well, we have a method then that is called electrical impedance spectroscopy, which we combine with artificial intelligence. So we are measuring by sending a very weak electrical signal. You can't feel it. It's very, very weak signal at 35 different frequencies and signal combinations to evaluate response from the signal. And the signals are affected by a lot of different things in the tissue, like structural organization, hydration, macromolecular composition, and so forth. And we have a series of parameters that we can present, but there are also possibility to use an AI classifier to assess the signals and present the results, depending on the application that we are looking at. We can even develop new AI applications for specific purposes in cooperation with partners if that is of interest. So we have a device with a pen. The pen has micro pins that penetrate into certain corneum and send in the signals into the tissue in various combinations. The total measurement time for one single measurement is 10 seconds. And from that 10 seconds, we collect 700 data points. So it's a lot of information that we collect in a very, very short time. And what are we actually looking at? We send in the signals and we see a spectra out of these signals. And of these frequencies that we send, we can see a lot of different cellular properties like the tissue structure, the integrity of cell membranes, the orientation of the cells, moisture compartmentalization, water loss, and so forth. And what you can see there on the right is two examples. To the left, the atopic skin, which you can see has a very different spectra than normal skin. And applying a classifier to this, you can also get a very, very accurate reading from the measurement. So you don't have to evaluate the spectra in itself. You actually get the measurement that you can evaluate. So what kind of studies have been done with this, and what are the possibilities with this methodology? Well, the first one is where we were measuring on atopic dermatitis patients and comparing by measuring on normal-looking skin, not on lesions, but on normal-looking skin, compare controls versus AD non-lesional measurements on these AD patients. And as you can see on the left-hand side, our technology EIS identified differences between those that are controls and those that have atopic dermatitis. Whereas in the middle figure, transepidermal water loss could not see any differences at all between these two groups. So it actually shows that our method is very sensitive, even when measuring on normal skin on those that have atopic dermatitis. And it's also possible to detect the subclinical non-visual changes in the skin close to a lesion, as you can see here. Here, transortalists could also see it somewhat, but not to the extent that our method could. Furthermore, the healing of skin could also be very accurately followed. Over the 3 weeks, for the first to last visit, there's a very, very distinct follow of the healing of skin, except for one individual where it actually got worse. And it correlates quite well with both pruritus, scorad, and transepidermal water loss. So it has an inverse correlation with the inflammatory biomarkers in serum. Also, we could see a long-term improvement in a patient that was using dupilumab or Dupixent over a treatment period of 5.5 months. So the measurement that we do correlated very well with the clinical outcome of the treatment. And transepidermal water loss could not capture this. So also here, it's a more sensitive approach using the electrical impedance spectroscopy method. And in another study, this was done on skin that has been excised on ex vivo human skin, where those different doses of laundry detergent were applied, and we could see a very significant dose response in our method to the dose of the laundry detergents with a very, very high accuracy. So that was just a snapshot of what is possible with our methodology if you want to evaluate the skin barrier within your research. Thank you.
Thank you very much, Per, for this very interesting presentation. Nevisance on Scibase is a new instrument coming in cosmetics, so I'm sure that the experts in evaluation in ingredients and in cosmetics company will be really pleased to know more about this new technology. Now we will present you the video that Margaux Jeanmougin from Byome Labs recorded, and it's 10 minutes, very interesting presentation of what can be do on with in vitro testing for evaluating the microbiome, but also in vivo, combining in vivo and in vitro with swabbing. So we launched the video, and we come back soon, and then I will present you my slides. Thank you very much for your attention. See you in 10 minutes.
So hello everyone and welcome. I'm Margaux Jeanmougin, the Marketing Director for Byome Labs. And today I'm excited to introduce you to Byome Labs, a French biotech startup at the forefront of microbiome science. And we specialize in microbiome testing and analysis for the cosmetic, dermocosmetic, and pharmaceutical industries. So this slide encapsulates our core mission to test, develop, and certify that your product respects the microbiome. We offer microbiology expertise specifically tailored for the different industries, such as cosmetic and pharmaceutical industries, like I said. So Byome Labs is a biotech startup specialized in the microbiome, testing and analysis for different industries, like I said. And we position ourselves as a microbiome expert at the service of your products and ingredients. And we collaborate with finished product brands, ingredient manufacturers, and distributors to help them and to help you understand and improve the impact of your product and actives on various microbiomes, including the skin, oral, vaginal area, and scalp. And our objective is to help you maintain verified and verifiable scientific evidence for all your marketing claims and regulatory files. So our in vitro microbiology lab and experts team are here for you. And first of all, I'm going to talk about the microbiome. So humans host approximately 100 trillion bacteria and microbes within our bodies, so collectively known as the microbiome. This is 10 times more than human cells and represents 2 kilograms of microbiome for 60 kilograms human. So this fascinating ecosystem represents the next frontier for innovation in the dermocosmetic and pharmaceutical industries. Major players in the industry and media such as L'Oréal, La Roche-Posay, BBC, etc. are already highlighting the importance and future of cosmetics and skincare being powered by microbiome science. So it's very important to know the microbiome and to take care of it. And we are proud to be a French biotech startup specialized in microbiome testing and analysis. And we specialize in 4 key microbiome, as I said: skin, scalp, oral, and vaginal. We test and analyze the impact of your product on the microbiome using state-of-the-art biotech techniques, incorporating microbiology, immunology, IA, and genetic engineering. So our offers are built on over 20 years of experience in personalized studies, providing personalized studies, standard microbiome respect certification, etc. So I'll go into more detail a little later in the presentation. So at Byome Labs, we fundamentally believe that microbiome science is the next revolution in beauty, allowing for personalized cosmetic products recommendation based on each consumer's unique microbiome. So our core values revolve around science, safety, and ultra-personalized approach. Science, because every test and recommendation we provide is grounded in robust data, advanced protocols, and continuous scientific monitoring. So our scientific rigor is embodied by our lab director, Stéphanie Badel, who holds a PhD in microbiology. Then safety. So our unwavering commitment is to the safety of your product through rigorous in vitro testing. We ensure biological safety supported by verified and verifiable scientific data. And our CEO, David, brings a strong background from DGCCRF and École Polytechnique, reinforcing our dedication to safety and regulatory compliance. And then ultra-personalized approach, because we understand that there is no two microbiome alike. And this is why we design fully custom solution, meticulously tailored to the specific needs of each brand, of each demand, and on each skin profile. So for us, mastering the microbiome is built upon three fundamental pillars. Index. This involves comprehensive analysis and understanding of the microbiome. Measure, because we provide precise and rapid measurement results. And recommendation based on the index and measurements. And we offer data-driven recommendation. So our unique know-how in microbiome is based on several key strengths. First of all, the double expertise, scientific and marketing. We offer both technical and marketing consulting. We are very expert on different secretum production, etc. We also have a large and complex strain library. We have mastered both planktonic and biofilm forms of bacteria, including wild type and reference strains, with strong expertise in complex strains such as Malassezia. We also have 20 years of experience with biofilms. Our specialists possess strong expertise in this specific way of living of bacteria. And we also are 100% made in France. And we also are able to be the Crédit Import Impôt Recherche certification. So this slide introduces our core offering, the Microbiome Respect certification. So it directly addresses the question of how your products or ingredients may impact the microbiome. The overarching principle is bacteria for real, because we know well the bacteria and how they communicate, etc. So to understand our certification, it's crucial to grasp that bacteria exist in two forms. Planktonic modes, these are free and mobile microorganisms living in liquids as plankton. And biofilm modes, these are organized communities that adhere to a surface. Importantly, the biofilm is the natural form of the skin microbiome. So our expertise in both forms is critical for comprehensive product assessment. Then this illustrates a critical point that similar products can have very different impacts on the microbiome. As an example, we tested the top 3 best-selling moisturizers on the French market in our microbiology lab. And although they look very similar on paper, their impact on the microbiome is very, very different, meaning they are adapted to different microbiome profiles. For instance, one product might exacerbate acne for certain skin types, another could trigger eczema, for example, and the third one might allow dysbiosis to develop. So this demonstrates the necessity of our in-depth analysis. So we have developed a robust framework to precisely position your product on the microbiome. So this framework is supported by our microbiome-friendly manifesto, a collective action aimed at scientifically recognizing the existence of the skin microbiome and its presence on every part of the body. Understanding that any product in contact with the skin can influence this microbial environment, which in turn affects skin health. Understanding the impact of interaction between the cutaneous microbiome and developed cosmetic products, and offering consumers products without negative effects on the cutaneous microbiome. Establishing a common definition within the profession for microbiome respecting cosmetic products, and providing a scientific and regulatory framework for claims made to consumers. So our commitment is supported by 5K sequencing operation and over 260 publication and analysis of clinical studies. And we also benefit from R&D collaboration. We are very strong board of advisor with many expert dermatologists, etc. So fundamentally, a microbiome respect product must preserve the balance and diversity of the microbiome. This is the core principle guiding of our certification. So our microbiome respect label offers 3 progressive levels of precision, depending on your needs. So level 1, it's foundational microbiome respect. At this initial level, you will receive our official certification and microbiome respect logo, allowing you to clearly communicate your product's baseline compatibility. You will also get a comprehensive scientific and marketing report, providing both scientific data and strategic insight for your marketing claims. And this level also includes an assessment of planktonic viability, which evaluates the impact on free-floating microorganisms. And these results are perfect, for example, for companies seeking initial validation and basic marketing claims regarding microbiome compatibility. Then we also have the level 2, so enhanced microbiome understanding, building upon level 1. So level 2 provides deeper insights. In addition to all level 1 benefits, you will receive a product benchmark, allowing you to see how your product performs against others in the market. We also assess biofilm curative resilience, which is crucial as biofilm represents the natural state of bacteria on the skin. So you will also benefit from a dedicated 30 minutes discussion with a microbiome expert to interpret your results and plan next step, for example, to optimize your formulation, etc. And this level is ideal for brands looking for a more thorough understanding of their products, impact, and a competitive edge. And then level 3, so it's comprehensive microbiome optimization. This is our most advanced level, offering the most comprehensive analysis for complete microbiome optimization, I would say. It includes all benefits from level 1 and level 2, plus a detailed microbiome respect scoring, providing a quantifiable measure of your product microbiome friendliness. We also analyze preventive biofilm colonization, which is key for developing products that actively support a healthy skin microbiome. And furthermore, you gain access to our scientific and marketing training materials, empowering your teams with in-depth knowledge, for example. So level 3 is designed for industry leaders and innovators who aim to formulate and position their product at the absolute forefront of microbiome science, ensuring optimal product performance and robust scientifically backed claim. The results of our analysis are versatile and can be effectively utilized by your R&D, marketing, regulatory teams. You will receive a full report and certificate in each case, which includes a scientific section, with protocols, results, and a marketing section with explanation, claims for your product, and all the things you need for your product. So thank you for your time and your attention today. We look forward to partnering with you to ensure your product respect the microbiome. For more information, please visit our website, so www.byomelabs.com, or contact us at info@byomelabs.com, or me directly on the Skinobs platform, or anything like that. If you have any project on the microbiome, we can help you testing, proving, optimizing your product and formulation. So thank you, and talk to you soon.
Sorry for this. There was a problem to share my slides. So we will speak about the trends, but I don't see. Okay. So regarding the testing exhibitors, then we will see the North American beauty trends and the key testing trends. So these are the panorama of all the exhibitors present at New York SCC Suppliers Day for the preclinical testing regulation and regulation, for the only clinical testing, both preclinical and clinical testing and instrumentation. So it's a lot, as you can see. And here you see the location of the origin of the exhibitors. So there were like 10% from Asia. North America represents 50%, and then Europe, Asia, and then other part of the world. And the most represented testing laboratory were offering both preclinical and clinical testing for 24 exhibitors, and then 10 only preclinical, and 13 for instrumentation, and 8 for clinical testing. What are the key numbers of the US beauty? Just as a reminder, this webinar will be recorded, and there will be a replay, and we will share the presentation of the other speakers, and I will share mine. So you will find all this information in the PDF and in the link we will send you. So the US market is the biggest one in the world with 335 billion. And the Indian market represents 10%. So it's really important. And the annual growth expected is almost 3%. And you can see American women spend an average of $3,756 per year. So that's a big amount. And online sales, it represents 30 billion. The top 10 beauty brands, I'm sure you know them very well, and we can focus on the US consumers' expectations, which are related to sustainability, customization, inclusivity, science-based results, multifunctional and simplified products, authentic brand value, virtual try-ons, multifunctional care, and honest in marketing. This is my favorite slide because here I represent for each show, for each region, a panorama of the key factors and the criteria, the parameters that influence the market, the beauty market, and and also the testing market. So what we see and what is new this year is that I had this to my presentation to say if it's growing or decreasing or stable. And so if we are looking to this big slide, I will say that the most important things is the increase and the apparition of economical and politics influence in this market, with everyone knows about that since last February about tariff. So the tariff impact ingredient sourcing, impact the investment of the companies and potential localization. So this is really the main point today. Maybe in 1 year it will be different. So the regulation constraints of the MOCRA seems to be less important than this one. And then beauty culture is still very important, a very important point influencing the beauty on the testing market with the scientific proof and the personalization, and for both skin and hair. Also the lifestyles, as I said in my previous slide, digital experience is still very high in North American market. Testing technology is mostly impacted by AI and neurocosmetics and biomarkers. Then skin physiology focus, there is no a lot to say, except maybe by microbiome. I will present other Skinobs barometer, and I think that the microbiome interest is the highest interest is in US. Then also with for pollution. Regarding environmental changes, even the expectation of the consumer are very high. I'm not sure it will interact with the testing market. So this is a more complex, more complete details of what I said before. So you find that in the final PDF. And then here it's some reminder for the MOCRA, what is MOCRA and what are the products considered drugs by the FDA. So you can see acne treatment, anti-itch, anti-gingivitis, antibacterial, antimicrobial, dandruff control, eczema, psoriasis, rosacea, which is in Europe more linked to dermocosmetics or dermatological products, and SPF. So this is the barometer of Skinobs. We built this barometer gathering many elements from consultants, talk, publication, articles in the magazine, meeting with heroes worldwide. And you can see here, USA is a dark blue, and we see that the most important thing is about multifunctional claims and moisturizing, microbiome, longevity and anti-aging, and inclusivity, and also acne. It's most important. And regarding what testing technology will influence the market in the USA. We will see that you have USA in blue, but not the dark blue this time. So the use of complex skin model, it's less than Europe, but consumer test is very, very important in US with special options with influencer or testimonies, or so this is very important. What we say about marketing consumer tests or marketing insights. So it's linked also with the neuroscience and the auto-evaluation questionnaire, what people think about the product efficacy, the product treatment, and also photo before after, because it's very easy to see the effect of the product. In the Skinobs platform, you can find more than 80 CROs listed for North America. North America includes US, Mexico, and Canada. And you see we have for preclinical assays about 47 providers of tests and 36 providers listed. It means that the one who did not answer our questionnaire are not in the platform, but here you find a lot of information. So just a fast focus on the key testing trends with longevity and hair care and microbiome. So longevity, it's 79% of US consumers want to prevent aging. There is this new skin age calculator by L'Oréal, and everyone, it's very trendy to know its biological skin age. What we can do for to test longevity versus longevity effect, of course, you can find all these methods in the platform. So it's just a small example of what you can find. So for face overall analysis, you have these 5 methods. Then for skin surface analysis, you have other instrumentation like the Antera, like the EvaSurf and EVA from EOTech, the video scan from CNK, and the C-Tube for Pixion. In the platform, you find all the principles of each instrument. I will focus for this time on the Nevisan Scibase and explain you what are all the benefits to use the Scibase instrument to study the skin barrier, and I will check globally the skin health. Hair and skinification, 34% of the Gen Z now are scalp-specific, need scalp-specific products, and it's very trendy. It's on every lips. We can test barrier function, we can test microbiome balance and irritation level, of course. And so you can test on strand, you can test in vivo, you can do scorage, you can analyze the surface of the hair, or you can measure the density, the combined effect, all the strengths, and you can use electron microscopy or the miniature from EOTech or the scalp surface with microbiome, or even Raman microscopy works very well. Regarding microbiome, so as I said, I think North America is the highest, it's where the microbiome effects are the most searched by the consumer. And here you will see in the video of Byome Lab a more complete presentation, but what I can say, because we hear a lot of things about microbiome analysis, and I want to say that you cannot do, not all the tests are the same. There are some tests like in vitro counting on strains. you choose your strains, and you put you add the product on the Petri box, and you count the strains. This is more screening, and then after you can also evaluate the taxonomy. So it means the quality and what numbers of what are the strains in your Petri box after swabbing, for example, or you can do also directly from the swabbing and by using S16 RNA and or LT, MSH, shotgun proteomics, a lot of methodology. So you can find all these information in the platform. So just connect, it's free access. Thank you very much for your attention. Our next webinar will be on July 10. We will come back from Korea, and we will have fresh news from Asia for you. And our next event participation we will be at IFSCC Cannes and Cosmetorium and in Asia, and also in India next year at Cosmetoday. Thank you very much. And she would like to, could you explain the difference between cornemeter, tiwometer, and EIS?
Yes, I mean, we measure the impedance over a large range of frequencies and at several different depths. So in the others, you typically get one value out of it. Here you can select between the multitude, and it's also different, a little bit different parameters that we are collecting with our method compared to a corneometer or a tevometer. So you could say that they are complementary. We provide a little bit more information than they do, and also with different parameters.
Thank you very much, Per. And there is another question. I think it's for you, Per, also. Have you published the skin barrier testing in partnership with any company?
Yes, we have one skin barrier testing or atopic dermatitis testing together with Kenvue or former Johnson & Johnson on the pediatrics to see if we can predict, and we have other data that is promising that also has been published to predict atopic dermatitis. But we also have a number of companies that are working with our methods, different cosmetic test companies that are working with our method. So they have more purchased our method, our device, and are using it in their internal testing.
Thank you very much. I have a question from Romane Contamine, and she would like to know what do you mean by complex skin model? Maybe that was I don't understand exactly the question about skin. Is it complex skin model? Per, do you have a specific answer regarding the Nevisance?
Complex skin. Well, we don't have a very complex this skin model. It's the methodology that is a little bit complex in how we or advanced in how we collect the information with different frequencies, different depth settings, and with our alternating current. I don't know if that is the actual question. So it's not a specific model that we are using. It's a technology that we're using to collect the information. If the person who asked the question could perhaps clarify a little bit what they are, what they want, or what they.
The question is from Roman Contamine. I don't know if she's already there. No, I think she's not there, but we will keep in contact with. We will remain in contact with her, and we will give her your mail address so she can directly contact you for that.
Yeah,
so
anytime, please. If there are any questions, you can contact me directly.
Thank you very much. So I hope that you learn a lot during this webinar post-show regarding the US trends and North American trends. Thank you for being with us, and we see you soon. Thank you for Per for attending, and thank you, Dr. Renato, for being with us, and Team Hauser also. See you soon, and have a nice end of the day or beginning of the day, depending on where you are. And if you are looking on the platform and if you are connected on the platform, don't hesitate to ask a question if you don't find your way. Bye-bye. Thank you very much.